Tuberculosis is an infectious disease that most often affects the lungs. It's highly contagious and is one of the leading causes of deaths worldwide. Data from the World Health Organization show around 10 million people fell ill with TB in 2020, with 1.5 million of them succumbing to the disease. But TB is actually curable and preventable. Let's get to know more about this from our guest this World TB Day, Dr. Marve Duka-Fernandez, Program Director or Coordinator rather, for Doctors Without Borders TB projects in Tondo, Manila. Good morning, Dr. Marve. Thank you so much for joining us. Now, Doc, your organization, Doctors Without Borders, has been providing assistance to communities in fighting TB. Please tell us, how serious is the problem of TB in the Philippines, and what kind of communities are most highly susceptible to the disease?
Hi, good morning, Paolo. Thanks for having me. Yeah, unfortunately, TB is quite serious in the Philippines. According to the World Health Organization, the Philippines remains in the top 30 high-burden countries for TB. And everyone can be affected by TB, but some groups are at high risk. So most especially in the community where we are working, they are at high risk because there is no possibility for physical distancing. And as we have learned from COVID, respiratory illnesses tend to infect more people when there is crowding, there is overpopulation, there are less sanitation services.
Right. Doc, I believe it's been about 139 years or so since TB was identified, and it continues to be a problem. It continues to be a disease that infects people and continues to be deadly in this day and age. TB affects our respiratory system the same way with COVID-19, as you mentioned, but has the TB situation in the country worsened because of COVID?
Yeah, this is what we feared, and it has come into reality. Because of the impact of COVID on a lot of health services, on a lot of government programs, TB is not spared. In fact, it is one of the more severely affected, and some progress that has been made on TB has now been reversed by COVID. And now we are seeing more deaths from TB. Less diagnosis and less people getting treated.
Right. I believe for the first time in a long time, 2020 showed an actual increase, like you said, in the figures, sadly. Now, Doc, just so that we understand, what are the symptoms of TB and how is it transmitted? Very much, in people's minds, of course, is the COVID pandemic, but the conditions actually for transmission are quite similar, if I'm not mistaken.
This is correct. Yeah, it's an airborne disease. So people are affected, or people get infected when someone around them coughs with TB. And this cough contains air droplets that have the TB bacteria. And people will usually manifest with cough, fever, weight loss, night sweats. These are the common ones. All right.
Doctor, TB continues to spread. Like you said, COVID has really sort of made it difficult for people to seek treatment. Are more people getting sick because this disease is changing, is developing? We have XDR TB, MDR TB. Is it a problem with this disease developing and changing, or is it a problem with people being able to gain access to proper treatment?
It's both. So when people don't get access to TB services, they harbor the disease longer, and they have a tendency to infect more people, close contacts, household members. And the severity of the disease makes people more ill. With the current COVID situation, they do not seek treatment and they would rather stay at home. If they were primarily infected with a resistant strain, then this is also what they will infect other people with. The access is complicating the situation. So without access to treatment, with quarantine procedures, with the health staff from the health centers being repurposed for COVID services, all of these is confounded.
All right. Well, today is going to be a busy day for you. What kind of activities have you got lined up to mark World TB Day?
We are celebrating the event with our partners, the Manila Health Department. We are strengthening our cooperation and highlighting some of our projects activities in Tondo.
Well, there you go. Thank you once again, Dr. Marve, for joining us this morning. We salute the work that you do. Please continue doing it. Thank you so much for joining us this morning here on New Day.